Well, today we're bringing awareness to a disease that's often unheard of. It's called Sjogren syndrome. It's an autoimmune disorder that affects parts of the body responsible for producing fluids like tears and saliva.
So here to talk more about it is Amy Krause, whose oldest child was diagnosed with it, and Mary Bauman, who's a patient. So thank you both so much for being here. So can you tell us a little bit about what Sjogren's is?
Sjogren's is an autoimmune disease. And it mostly affects your eyes and your mouth by drying them out. But it is a systemic disease. It's very serious, and it does affect almost every organ system in the body.
And your oldest child was diagnosed with it.
And my oldest child was diagnosed with it when she was 13. And for her, it's mostly, she has very chronic pain. There's a lot of pain involved with Sjogren's, and also she has a lot of just profound fatigue.
Yeah, I'm just going to fix your microphone because we're getting a little bit of feedback. There we go. Mary, you have Sjogren's. So can you tell me a little bit about your experience with it?
Yeah, I've had it. I had the precursor of it 50 years ago, this month actually, when I got Epstein-Barr virus, or EB virus, and it kind of lit the fuse for Sjogren's. It was profound fatigue, and I was in depression, and I was off work for 6 months, and then the EB virus just lingered in my blood tests for years. Wow. And over the years, I gradually started getting some of the symptoms that became what is my Sjogren's palette today, like irritable bowel syndrome, acid reflux, dry eyes, dry mouth. And then in 2000, my peripheral neuropathy really started going because the Sjogren's attacks the nerves in some of us. And in 2009, I finally understood just how broad-reaching Sjogren's is, and really began to research it through the Sjogren's.org, through the foundation. And it's a progressive disease, and it's not political. It just keeps going on.
Yeah. Well, tomorrow you have the first Midwest Walk for Sjogren's coming up. Tell us a little bit about what that's, what your goal is, what's going to be happening.
So the goal is to raise awareness so that more people know about the disease. Sjogren's is actually more common than lupus and MS combined, but people have not heard of it before, so we're hoping to build awareness. And it's a fundraiser for the Sjogren's Foundation, so they can continue to do their advocacy work, their education for patients and providers, and so that they can fund novel research projects, so that they can find a cure. Currently, there is no FDA-approved treatment just for Sjogren's, so they are working on making that happen for patients. And it's going to be tomorrow. It's going to be in Elver Park from 8:30 to 11:30. You can register online, or you can come to the walk and just register when you're there. And it's going to be a lot of fun. Maynard the Mallard is going to be there. We're going to have kids activities. There's going to be a band, and you can also ask these experts. Dr. Sarah McCoy is going to be there, and she's amazing. She's out of UW Health, and she's doing research with stem cells to help dryness in your mouth for both Sjogren's patients and cancer patients. So it's really exciting that we're going to have access to her and be able to ask questions. So it's pretty exciting. And if there's children who have Sjogren's in the community, parents, please bring your family, because there's going to be experts on pediatric Sjogren's there as well.
So, well, incredible work, and I wish we had more time to talk about it, but we'll put more on our website, wkow.com. Thank you so much for being here and for sharing.
Thank you. Thank you for having us.
Yes.